So again, my name is Susan Davidson, and it's my distinct pleasure to welcome you to this panel. I have here joining me three wonderful speakers. We have their extended bios in the program, so I'm not going to go through their entire careers and tell you who they are. I will let them do that in a minute. But I will start with Lilach Mollick, who is the Director of Pedagogy at Wharton Interactive, so we're going to hear a lot about education today. I also have Heather, I'll jump to you. Heather, who's the General Manager of Education Solutions Sales at Microsoft, Hether Danforth. And then Hamsa Bastani, last but not least is the expression. Hamsa is an associate professor of Operations, Information, and Decisions, and the co-director of Wharton Healthcare Analytics Lab. So those are our three speakers. We're going to have a range of questions, and I would love to hear your questions at the end. I will start with some, and then we'll move on. But I thought before we dove into some of the questions, perhaps I could ask each of you to briefly introduce yourselves so that people know where you're coming from and why you are what you're doing now today. So, Lilach.
Thank you so much, Susan. So I'm Lilach Mollick. So much for a smooth introduction. So I work at Wharton Interactive, and we've spent many years building games and simulations for teaching. One of the things that we try to do is really personalize all of our experiences, including branching story narratives, really adhering to the lesson. I wrote my doctorate about personalization, interactivity, and teaching, and when ChatGPT 3.5 came along, we saw that 80% of what we were doing, the improvisation, the adaptivity, the initiative, could be done by chat really easily with one prompt. So that sort of blew our world apart. And since then, we've been experimenting with AI exercises for students, for instructors, and AI-powered simulation. So nerve-wracking, but very exciting world.
Does this work? Yes. Okay, cool. Hi guys, I'm Hamsa. My daughter's kicking, so she wants you to know I'll be talking on behalf of both of us. I'm a faculty in ops, like Susan mentioned. Very cool panel. And I've mostly been working on machine learning for healthcare, especially interested in for public policy problems. So in the past, we've worked with like different national governments, like we worked with the government of Greece to do targeted COVID-19 testing during the pandemic. Now we're working with the government of Sierra Leone to like improve their pharmaceutical supply chains in a data-driven way to basically optimize unmet demand for patients across the country. And one of the things that we got really interested in, I haven't done generative AI as long as either Heather or Lilach, but one of the things that we got blown away by was that a lot of the challenges in these settings is that we're working with non-technical policymakers and we're trying to explain this very complicated black box algorithm to them. And they're not often familiar with concepts like variance and confidence intervals. So it's like a very, very challenging manual labor to like figure out what is the right way to represent this information in a way that they understand. And remarkably, ChatGPT is very, very good at that, at like bridging that gap, which is kind of what we struggle with. So we've been thinking about using ChatGPT, I guess, also for education, but in a way that like helps us bridge the gap between non-technical policymakers and like kind of the machine learning side.
So Hether Danforth, as she said, I'm the general manager for our solutions team, which is in education. And I've been at Microsoft for about 14 years, primarily on the enterprise side, working with our customers to really understand the value realization and then help deploy and adopt many of our technologies. But then I was able a number of years ago to really channel my passion around education and healthcare and move over to the industry. So I'm doing a similar role, leading teams that work directly with some of the largest K-12, higher ed, academic medical centers across the US. Not only certainly many of Microsoft technologies, but now many of our Gen AI capabilities. So just sort of the explosion of ChatGPT and Copilot is some of what I'll talk about today, but just, I think the opportunity for disruption in so many industries is certainly there, but no more than education and healthcare is what I'm seeing today. So just super excited to be here with all of you.
Well, thank you so much. It was a great lead into, I think, my first question of Hamsa, which is what role does machine learning and generative AI play in healthcare operations and decision making today, and how do you see it evolving over the next decade?
Great question. I think I'll separate machine learning and generative AI here. So I think we're getting to the point where healthcare costs are rising so much that we basically have to do very, very careful resource allocation, whether that resource is, physician time, we're facing physician shortages and nursing shortages, or like when you're working in developing countries where you're facing like drug shortages. And so every problem that we're thinking about is really about like who needs it the most. So that's a prediction problem, and making sure whatever supply you have, which often might also be variable, goes where it needs to be to maximize population health. I think that's sort of the general window. I think generative AI is a really awesome technology that has like power to reduce these resource constraints. So for example, if you have physician shortages or nursing shortages, if we can use these tools to, for example, fill out or at least draft medical notes, then we might be able to better leverage their time towards being patient facing and actually collecting things that only a human can collect. And so that's really where I think the immediate field is going. There's a lot of interest in making these things patient-facing as well, to like do diagnosis or like mental health therapy. I personally think we're not there yet because there's a lot of biases and equity issues that are hidden in these algorithms that we really don't understand and don't even have good metrics to evaluate yet. So I think we're still at the point where it needs supervision by a clinician, but with that effective guardrail, it can significantly improve productivity and reduce these resource constraints.
And I don't mean to cut out any of the other panelists. If you have something to say about the question, you feel free to chip in as well. So
Please do.
I saw Lilach move and I was like, oh, I think I cut her off. So
Actively listening.
oh, actively listening. Oh, okay, that's a good thing. Well, Lilach, while I have you on the hook, where do you see the biggest wins in using generative AI for teaching and learning, and where do you see the biggest risks?
That's a great question. There are, I think, so many of each in each category. So the biggest wins really lies in interactivity. It's a dialogue machine. So instead of looking something up, it can talk to you. And we know from sort of decades of studying tutoring that the more time the student talks, the more learning opportunity they have. So the dialogue and the interactivity is a big thing. The other piece is there is the improvisational capacity. They can improvise across a tutoring episode, across a role-playing episode, and adapt to each user. That adaptability is really key. And then the third sort of big win is the invoking of others. So in a classroom, it could be a teammate, a skeptic, a devil's advocate, a coach. And then for instructors, it could be a teaching assistant who can do just about anything. The sort of downsides, I think, are also, unfortunately, just tremendous. One thing we can't do is sort of go on as we have before because the paradigm has shifted. We can't just...
I've noticed that.
Yeah, you've noticed that? Yep. We can't just say, okay, let's just adopt AI. We need to be really thoughtful about this. The downside, I think, is really learning loss. They are sort of the perfect cheating machine. So how do we use them to lead students through a process, to activate hard thinking, versus just having students use them?
And it is so hard to catch cheating because it's
Absolutely.
very convincing.
Absolutely.
One thing you didn't mention is patience. I know that as an instructor, I'm not very patient, and I've noticed chat is infinitely patient. So,
Chat is infinitely patient. It doesn't care. It doesn't have a soul. So yes, infinitely patient with any student at any learning level, which is amazing.
But it's still billing your credit card.
yeah, there's a different direction of funds going on. Cool. Okay, great. So, Heather, not to leave you out here, how do you see generative AI being leveraged to enhance educational experiences at various levels? So we're all dealing with higher education, but you also deal with K-12, especially with the combined technologies of ChatGPT and Copilot, which has been around for a while. So can you talk to that?
Yeah, and again, I think we have to always be super mindful of the risks that are inherent here. But and Microsoft in general, we sort of approach all of our customers with our responsible AI principles. With that said, I think I would say we're seeing 4 different areas within education that ChatGPT, Copilot, and sort of Gen AI is really taking off. Personalization, certainly, where sort of the systems, the AI systems can adapt to a student's learning and target strengths and weaknesses. We're working, for example, with an ISV, so an education technology vendor that develops assessments. You can target specific learning outcomes or objectives, and then make sure that based on sort of the grade level, the assessments, they can then build on what the students are doing and adapt as you go along. So personalization, I think, is, and because students learn differently, I think that can be really powerful. The second one is around creating curriculum. We actually have a K-12 school in Kansas where the teachers, 4th to 6th grade, actually took some PDFs and put it into Copilot. And was able to generate in literally minutes a new sort of quarter-based project for her students, which would normally have taken her 8 hours. Now, she's going to go on and certainly do some tweaks to it, but at least she has something really powerful to start with and something really interactive that she can leverage. The third is around tutoring. This whole idea of making sure that we're sort of meeting the students where they are, sort of sourcing data specific to a curriculum or a study area, and making sure you sort of teach this tutor bot, so to speak, how to help students in sort of the manner that they need to get some of the feedback back so they can ask questions along the way. And I'd say the fourth is more on a macro level. So institutions or even departments can take data and analytics to understand what's going on to build sort of predictors on why are students not doing well, or what is the student attrition rate, such that you can sort of build in interventions along the way. And I think then the goal of sort of the student graduation rates increasing becomes a reality if you understand what's going on sort of at that micro level. So those are some of the things that we're seeing with our education customers.
It was interesting you talked about some instructor using it to generate a project for a course. So I have also, none of these people are students in my class, I hope. Oh, put your hand down. Yeah, so I get very tired of making up my own assessments year after year, so I thought, well, I'll let Chat help me out here. And it did very well for one. It came up with a really good example, but for the exam questions, they were really boring. They were really, really terribly boring questions. So I don't think that Chat yet knows how to design good questions. And Lilach, you're going to tell me I phrased it wrong, so tell me why I'm wrong.
Boy, I can't hide anything. Okay, so I will say that Susan is right that when you ask a question, it seems to sort of seek from its comfort zone, from sort of like the average, here's what's okay. To design something worthwhile, to design something that is truly diagnostic, I think that, at least for right now, part of the prompting is sort of knocking it out of its path of least resistance and asking it to look in its word space or latent space into something else. So I will just give you a very brief example. When I was testing a tutoring prompt, I said, all right, talk to me about long-term memory. Give me an analogy for long-term memory. And it gave me an analogy that was like, it's like a library, it's like a storage space. That's a pretty terrible analogy because, of course, it sort of brought up the salience of long-term memory is permanent, but it didn't address the malleability or the shift that we have in memory. So I literally had to say, aha, but keep in mind that we update our memory as we recall, and that memory shifts. So now give me an analogy that both encompasses the permanence and the malleability of it. And so it did much better. Not perfect, but it did much, much better. And so I think that like we sort of have to actively work to just knock it off its like middling, boring, okay-ish answers. I guess we might take it.
So it's sort of like talking to a teenager and getting beyond that monosyllabic. Oh, sorry if there's teenagers in the room. But thank you. Let me return to Hamsa. And I know that this idea of challenges, downsides, but what are some of the ethical challenges that arise when using generative AI in healthcare, especially when it comes to diverse and underrepresented populations? You broached that earlier.
Yeah. No, I agree. This is something I worry about a lot, and I think a lot of people worry about a lot. So first of all, whenever you use machine learning from like large data sets, you have to worry because you can't vet the data to make sure it's fully representative, it doesn't have any biases, and so on. But at least when those models are interpretable, we might be able to look at the downstream decisions and adjust them using like auxiliary data sets or something like that. With generative AI, the problem is that, it's so unstructured. We don't know the exact use case. We don't even know how to define what it means for something to be fair or ethical. A lot of this work has actually come out of the Microsoft group for supervised learning. But I think now that we're talking about these large language models, it's hard to even define what we mean by ethical. So we have a lot of these case studies where people will say like a female patient asked about, symptoms. They were having symptoms that looked like a heart attack, but then it said that they're probably needing like psychological therapy or something like that. Whereas if a man puts in those same symptoms, it immediately directs them to a heart attack. So like there are these like very insidious examples that you can find of these biases being baked in. And this is partly because of human data, because like we've generally not diagnosed heart attack well for women, and we have for men. And so it's unclear how we are going to go about resolving those issues. The other issue is underrepresented patient populations. So this happens especially in developing countries, but also in the US when you're looking at populations that don't easily have access to health systems. Often, like if we see that a population has had no health treatment, we assume that they're healthy. But that's actually not the case. It's just that there are structural barriers that have prevented them from accessing health. And so we should be very careful not to conflate those, because then when we're actually allocating our limited health resources, instead of helping improve these patient populations, we're just sort of saying, oh, they don't need anything, right? This happened a lot in like our Sierra Leone study, for example, where like rural villages would like not have a lot of medical demand because they don't have access. And then the model would look at that and think, oh, they don't have medical demand, so we don't need to send them anything, which creates this like terrible feedback loop. So those are things that I think I'd be very concerned with. But I think the current use cases, at least in clinical decision support systems, are settings where there's a clinician supervising what the algorithm is doing, and so we have at least this human guardrail. But I'd be very worried about letting these things into the wild to make actual decisions for anyone.
So I guess that raises the question of people using chat to self-diagnose, right? So they go, everybody, I have a headache and I have this symptom, and so the ethical considerations there as well. It's like, who do they sue when it gets it wrong, right?
I've used it multiple times during my pregnancy, and it's never ended well for me.
Okay. This is very useful to know.
Don't look up your symptoms.
I know. I have a daughter-in-law who has a 7-week-old, and she gets worried about the weirdest things. It's like, babies breathe, that's what they do, all these things that she worries about because of the internet. And chat doesn't help at all. So let me turn back to education and ask, let's see, who am I going to go to? Lilach, how do we as educators balance the upside of generative AI as a productivity enhancement tool with the downside of it producing more cheating opportunities for our students?
That's an awesome question. I think very carefully. So I don't necessarily think it's a trade-off. Yes, chat can certainly enhance productivity, help you with lesson plans, help you with project ideas, et cetera, sort of act as your teaching assistant. But it can also, do wondrous things like role play with a student, like give students feedback, like help students overcome whatever misconceptions they have about topics. So I think that the way to introduce it is actually in part to roll your own ed tech, which is entirely possible now with custom chatbots that I know are available with Microsoft, OpenAI. No doubt others will come up with them too, which is using your expertise and pedagogical content knowledge, to lead students through a process that really puts the cognitive burden on the student. So that's one way to do it. The other way to do it is to double down on strategies that we know have worked, like really active discussions in class, assessments in class, formative assessment. So I don't think that there's an easy answer because a student can always go home and, cheat. But I also think that this is not a new phenomenon, that, cheating's been going on for a long time, Googling things has been going on for a long time. This just puts a spotlight on the downsides that have already sort of been at play for a long time.
So I'd like to take issue with that just a little bit. First of all, I teach hundreds of students. It's really hard to get a discussion going with hundreds of students, so that doesn't help. And then the other phenomenon, which is I have a homework which, if I were to do it, and I've done this for a long time, takes me a good 3 hours to do. I expect it will take at least 10 hours for my students to do, and I walk up to chat and I can get it done in a half hour. So that's an issue. And, actually chat did very well, and it probably trained on my homework because it used the same variables as I used. So there's this issue that it changes a lot in education from my perspective.
So just to follow that up, yes, I don't think we have a real answer yet. I think that, for some classes it'll work, for some classes it won't, but it's certainly worth a rethinking, absolutely.
So Heather, I saw you nodding your head. So would you like to jump in here?
Yeah, I mean, I think it does start to fundamentally sort of change how we need to think about sort of that, the overall engagement, and but I also think it opens up an opportunity to learn in completely different ways and engage in completely different ways. So I think it is challenging in that, it's very readily available for people to sort of skip the important steps to understand how to build those analytical skills and how to build sort of the debating skills. But I think we just need to maybe think about it and approach it in different ways over time as well. I don't think we know exactly what that looks like yet. I think it's going to be a lot of trial and error and a lot of probably public discussion like this to see where we can get to on the other side of that.
So following up on that, so what impact is ChatGPT and other technologies having on student engagement and learning outcomes from your perspective as an educational technologist?
Yeah, and I think it sort of builds right on top of what we were just talking about. I think that there are incredible opportunities here from an impact perspective in terms of what we can do to enable equitable education, in terms of how different students and kids learn. My son has all these learning disabilities, and he just never really did well in sort of the classics classroom in terms of what that looked like. But once we were able to, and this was a number of years ago, sort of provide different ways of learning, it really helped him. So we actually have been working with a university in the Midwest, and they developed their own custom co-pilot for a number of different classes for the fall term. And what they actually saw at the end were not just improvement, but an entire grade improvement and engagement. So it wasn't just sort of okay, I'm going to use the tutor bot or this custom co-pilot to help me do my work. It was actually allowing the students to interact with the let's say in one case it was the tutor bot to ask questions that they didn't feel comfortable asking in the classroom or asking their peers, or maybe they couldn't find the teacher at the end of the day. Because to your point, a lot of these classes have hundreds of students in it. So it's just like, that's pretty scary to be asking a question. So, in terms of sort of learning outcomes, that's one of the things that we're seeing is it can actually improve where students feel less or feel more confident about asking and getting some information. I think the other, actually, our CEO, I heard him on a recent podcast, and I thought this insight was really important. So he studied electrical engineering, so he's a trained electrical engineer, and he had always struggled with Maxwell's equation, which is the sort of equations that look at the interaction between sort of like the power, basically, the magnetics and electric. And he finally was able with ChatGPT to actually visualize these equations. And for him, like literally years later, he finally understood that. Like this just happened for him recently. And his point was that our ability to understand these really complex topics, really we can expand how we allow for this kind of education. And it really opens up the aperture for so many more people to get into and potentially learn many more topics of study. So I think those are some of the early sort of things that we're seeing across education and research and other areas.
So I think that I've been hogging these wonderful speakers. So I'd like to open it up to questions from the audience here.